Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our Blum Center Cancer Center series, a special collaboration between the Blum Center and Mass General Cancer Center. Before I get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it will be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has music and hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. All right, so to kick off our Cancer Center series, I have the pleasure of introducing you all to our, apologies, our lifestyle medicine team and our guest of honor, who will be here to lead today's session.
Welcome, everybody, and thank you for having us today. I'm just going to pull up my slide as well. Okay, looks good. So we're here today to be talking to you about our Mass General Cancer Center Lifestyle Medicine program, and just go right into the next one. Our topic is lifestyle medicine for patients and caregivers, support for living a healthy, long life along the cancer journey. My name is Lauren Winters, and I'm a nurse practitioner in the Mass General Hospital Center for Breast Cancer, and also the assistant director of the Mass General Cancer Center Lifestyle Medicine program. And it's with great pleasure that I join you today, along with my esteemed colleagues, Carol Sullivan, who is our lead nutritionist, and Rachel Milstein, who's a clinical health psychologist. We're so grateful to have been invited by the Maxwell and Eleanor Blum Patient and Family Learning Center to talk to you about the Mass General Cancer Center Lifestyle Program and provide useful tips on how individuals with cancer and their caregivers can use lifestyle medicine to improve their health and well-being. But before we go further in our presentation, we'd like to invite you to join us in a brief mindfulness exercise to help you feel more at ease and focused in this present moment. With ease and focused, we are better equipped to handle the challenges that come our way. This guided practice is designed to help you reset and experience what is called the flow state. In the flow state, we feel effortless and experience more confidence in our thoughts and actions. So if you'll join me, begin by sitting upright in a way that feels effortless. Let the chair and the ground be there to support you. Let go of any rigidity in your posture. Begin by noticing your breath, feeling the movement of your breath within your body, where it is. Soften the muscles of your body as you exhale. Just enjoy the natural flow of your breath. Don't try and control it. Think just this. If it helps, attach the words just to your inhale and this to your exhale. Just this. Sitting and breathing without any effort. Now, imagine yourself doing something you have to do without the usual strain and effort. Notice how it feels to approach the action or conversation with ease and effortlessness. Imagine actions happening through you without struggle or straining. Now, let go a little more. Let the chair and the ground support you. Just this. Inhale to exhale allowing your breath to flow through you. Just this. Inhale to exhale, allowing your breath to flow through you. So take a moment to savor this experience. And when you're ready, open your eyes and smile to yourself or the person sitting next to you. Okay. So I'm so glad you joined in that exercise so that we're all in the flow state as we begin our conversation about what is lifestyle medicine. So, lifestyle medicine is a medical specialty. It's focused on the preventative healthcare and self care. It's research, it's education, it's the treatment of disorders that are caused by lifestyle factors. It's also a patient centered approach. Lifestyle medicine is not fad diets, alternative, or even integrative medicine, right? That's its own science. It's not about supplements or sort of medicines or things like that. But it's also not a replacement for medications that are needed or other procedures. And it's really applicable to all diseases, all people, well or ill, or anywhere in between. So we know quite a lot about how lifestyle and behavioral change for the betterment of health is effective, and perhaps even what types of these behaviors impact chronic disease risk reduction, for example. But there's really so much more to learn. For example, the development of what types of interventions work best for what groups of people. What are the most effective stress management techniques? Um, how best to involve patients and families, caregivers, and the like in those lifestyle interventions. So lots to learn. There are 6 pillars of lifestyle medicine, and these are described by the American College of Lifestyle Medicine, beginning with nutrition. And the basis behind that pillar is to choose predominantly whole plant-based foods that are fiber-filled, nutrient-dense, health-promoting, and disease-fighting. The second is sleep, and that's to identify and alter dietary or environmental habits that may hinder a healthy sleep. The third is exercise or physical activity. Being regular and consistent with your activity is an essential piece of an optimal health equation. Substance abuse, avoiding or cessating addictive substances can help decrease the risk of many cancers and heart disease, for example. Stress management to identify positive and negative stress responses with coping mechanisms and reduction techniques for improved well being. And then, lastly, but never leastly, healthy relationships. To create and maintain healthy social relationships is critical to our overall health. These 6 core principles, we all agree, make individuals healthier. So, how is lifestyle medicine important in oncology care? So, we know that cancer is a complex condition, and for many people, it's a life changing event. Cancer and cancer therapies can affect almost every aspect of a person's life. And we also know that caregivers of people with cancer may experience stress and put their own self care needs aside when they're supporting their loved ones with cancer. Lifestyle medicine empowers individuals with knowledge and skills to make effective, healthy behavior changes. Lifestyle medicine can help people reduce their risk of various health conditions. And lifestyle medicine really considers the whole person, not just the cancer or the disease or what have you. So we know from research that lifestyle medicine is relevant in oncology care. We know that social connections and maintaining relationships during cancer are among the most important factors that predict long-term health and well-being. We know that there is increasing evidence that exercise is beneficial in people with cancer. Studies have shown that exercise increases survival from certain types of cancer, can help regulate appetite, maintain a healthy weight, improve sleep, lessen feelings of fatigue, and improve the ability to complete daily activities of living. And then also impact mental health by reducing feelings of anxiety and depression, overall improving quality of life. We know that nutrition is also essential. Good nutrition can help achieve and maintain a healthy weight, build and maintain energy, and help prevent infection. Sleep problems are common in people with cancer. There are many causes of sleep disruption related to cancer and cancer therapies. Moreover, people may have been experiencing problems with their sleep before their diagnosis, which have worsened over time. Poor sleep impacts all the other lifestyle medicine pillars, so it's so important to address sleep during the cancer journey and beyond. Stress management, stress, anxiety, and depressive mood are common among cancer patients and their caregivers. Mindfulness and stress reducing techniques are, as well as nearly all of the other pillars, can help in reducing the impacts of stress. And then finally, avoiding risky substances. Substance abuse disorders are very common among people with cancer. And cessation of risky substances is an important aspect of preventative care and an opportunity to replace negative coping strategies with positive ones. So we have designed the lifestyle medicine program at the Mass General Cancer Center to further this work. We provide individualized lifestyle medicine consultations, shared medical appointments, these are group visits, and the Paving the Path to Wellness program for breast cancer. And I would add that currently we also have a Paving the Path to Wellness program for multiple myeloma patients. This is our beautiful group of individuals. This is not even all of us, actually. I'm missing one or two pictures that are part of the program. We have a multidisciplinary, rich group of very, um, gosh, wonderful people who are also passionate about lifestyle medicine and are doing each and every one of them their own work in building the science and also building the program, bringing this work to our patients. So, a typical lifestyle medicine consultation, any Mass General patient with a diagnosis of cancer will benefit from addressing the following: physical activity recommendations, cancer-related fatigue. There's many other reasons for referral. And we do a comprehensive review of the 6 pillars of lifestyle medicine and provide holistic care. Patients complete a pre-visit survey, which asks about their lifestyle behaviors and what their needs are. And then we provide treatment and also follow-up that may include referrals to other supportive care programs within the hospital, even also out in the community. We communicate our recommendations to the primary oncology team, sometimes even communicate with primary caregivers or other allied health professionals that are following those folks. And we also will refer patients right into our group visits if they're interested in continuing on in their learning. So this has just been a wonderful program that's really evolved over the past, 5 or 6 years, I'd say. And we continue to work to, bring these types of events as well as one-on-one consultations to our patients. And we're very, very, again, grateful to be here to talk to you about it and spread the word. So without further ado, I'm going to pass the baton to my wonderful colleague, Carol Sullivan, who will be talking about sugar and cancer.
And overall nutrition. Did we want to do a quick stretch break?
Sure, Carol.
If you want to stand, if you're not standing, you can do a stretch, or you can just stretch your arms and your legs, your neck. Make sure that you're breathing. Feels good to move your body a little bit, even if you're in a chair. So just to give everyone a little bit of an overview of some of the things that we might go over with people who are coming into a nutrition, lifestyle, medicine, cancer center visit. We do a lot, I think, of myth busting. So I've kind of pulled from one of our other presentations that we did recently on nutrition and cancer myth busting. I'm not going to take a deep dive. You can definitely refer to the other presentation, and hopefully we can get that linked in the Blum Center as well if you want to refer to it. But I think some of these myths really do prove to be a source of anxiety for patients and caregivers. So I thought it was a good idea to address some of these. But we are going to start with sugar and cancer. And if Lauren, you go to the next slide, I think it's this is an important one to talk about because this myth is so pervasive online and in social media, and from Uncle Bob or whoever is telling you that this might be an issue. So I am going to kind of take the long-winded explanation because this is kind of one of those half-truths where the myth is sugar feeds cancer, and this is not entirely true. The facts here are that when we eat carbohydrates that are in any fruits, vegetables, potatoes, peas, lovely tubers and winter squash that are available right now, whole grains, beans, legumes, lentils, candy, cookies, cakes, ice creams, all of these things have carbohydrates in them that turn into glucose, which is known as blood sugar. Now, cutting out all of the sugar in our diet does not restrict blood glucose, does not restrict glucose from getting into cancer cells. Your body always has to have some glucose present in the blood. And if you do not eat carbohydrate containing foods in your diet, your body will use some protein from muscle and from fat and turn that into glucose. So even if you completely restrict, it's not going to significantly lower your glucose. Also, food containing natural sugar like fruit provides really essential vitamins, even starchy vegetables, grains. These foods all provide essential vitamins, minerals, fiber, and then phytonutrients, which are these nutrients in plants that have these bioactive roles in our body in preventing chronic disease that are really cool. Our last fact here is that excess added sugar should be avoided most of the time, with the caveat that if you are losing weight and you have a really poor appetite, sugar can actually provide a source of calories or energy. Go to the next slide, Lauren. So the question is sugar something to limit? A little bit more of an explanation before we get to that answer. Sugar intake affects this substance, this hormone called insulin. Sugar affects insulin production, and insulin is both necessary for life, but it is also a growth factor. So chronic high intake of added sugar can contribute to excess insulin production and excess body weight, and both of these have been associated with increased risk of cancer. So what is the bottom line after all these words? The bottom line is to aim to reduce added sugar. And eating small amounts of added sugar, even on a daily basis, will not directly feed cancer cells. Fruit also does not count as added sugar, and really reading labels in packaged foods that have been processed or minimally processed even can be really helpful to try to decrease added sugar in the diet. So if you look at the new nutrition label on the right-hand side, the area that's highlighted will show total sugars, and then beneath it, the new label does require added sugars to be listed. So the next time you're in a grocery store and you're picking up a packaged product, just take a peek at 2 different brands to see which might have less added sugar. So that's a taste of the added sugar talk. You can go to the next slide, Lauren. The next big one that we still get a lot of is about soy and cancer, especially when it comes to hormone-sensitive cancers like breast cancer and prostate cancer. If you go to the next slide, Lauren. And we actually love soy in the Lifestyle Medicine Clinic in the Cancer Center. The myth here is that soy products increase the risk for hormone-sensitive cancers and should be avoided, when really, I think some of the messaging gets confusing in the fact that soy contains isoflavones, and these isoflavones have a chemical structure that's similar to your body's estrogen, but is different from your body's estrogen. I think that's where the messaging gets lost. We actually love soy because the large body of research at this point says that soy products and other foods that have isoflavones like ground flaxseed do not have a a negative impact on cancer. In fact, these foods might actually be protective, which is fantastic because soy has so many other benefits. Like it is a good source of plant protein. It's packed with fiber. It's packed with omega-3 fats, which are really anti-inflammatory. And these omega-3 fats are well known in like fatty fish like salmon, and then walnuts, ground flaxseed, but soy also a decent amount of these. And soy also has some great vitamins and minerals that we care about. So the bottom line is that soy is not only okay, but it's beneficial. So we like to encourage people to use whole soy foods like soy milk, tofu, edamame, and tempeh. If you don't like these foods, then it's a non-issue if you don't want to include them. But we do like to encourage soy foods for all of its awesome health benefits. There's also some good cardiovascular protective benefits too. And then the last note here is just avoid soy in supplement form. The next chunk of what I'm presenting here is the whole food plant forward diet, which is what we encourage and what the lifestyle medicine oncology groups all encourage. So if you go to the next slide. The myth here that I'm presenting is that there is a diet that can cure and or prevent cancer. And the facts are, again, from a really large body of evidence that eating a mostly plant-based diet that includes all of these foods we've already mentioned, whole grains, vegetables, fruits, nuts, seeds, beans, and legumes, plays a big role in preventing cancer and also contributing to health in general. And there is no diet that ensures you will not get cancer, and there is no diet proven to actually cure cancer. Next slide. That brings us to this infographic that comes from the American Institute for Cancer Research and the World Cancer Research Fund. And they've taken all of the research and synthesized it down into these 10 lifestyle recommendations. And if you want to go check this out for yourself, the American Institute for Cancer Research, AICR, which I think we're going to use provide as a resource at the end of this talk. They do have a lot of good articles and blog posts about each one of these, but the primary ones that are related to diet are eating a diet rich in grains, fruits and vegetables and beans, limiting consumption of fast food and other processed foods that are high in fat and sugar, limiting red meat. The recommendation is actually less than 18 ounces a week, and to avoid processed meats like hot dogs, hams, anything that's been salted or cured, sausages, pepperoni, things like that. Limiting consumption of sugar, sweetened drinks, like fruit juices and anything else that might have added sugar in it, and limiting alcohol consumption. The recommendation actually is no alcohol, actually, from the AICR and the World Health Organization, since it is considered carcinogen. And then the last one is do not use supplements for cancer prevention. So again, AICR has some great info here. Lauren, if you go to the next slide, try not to read the whole thing. I'm just going to say a few lines about this. This is a schematic that comes from 2022, an article in the Journal of the American Medical Association, Oncology, published an article comparing all of the mechanisms or ways in which a whole food plant-based diet and all of the ways in which a ketogenic diet might help to reduce cancer. And you'll see on the left-hand side in the green boxes are the whole plant-based diet, and on the right side is the ketogenic diet or a very low carbohydrate diet. And you'll see the purple boxes are some overlap that both diets may use a mechanism that might reduce cancer. So there are definitely way more mechanisms on the left-hand side for the whole food plant-based compared to the very low carbohydrate diet. So if you want to check that out, it's a cool high-level science article, but again, just driving the point home for the whole food plant-based diet. Thanks, Lauren. Next slide. Adding to the benefit of eating a lot of plants and fiber is this cool information about the gut microbiome, which the gut microbiome are the organisms in the GI tract that provide nutrients and vitamins, protect the body from pathogens, and modulate the function of the immune system. And the facts here are that short chain fatty acids, this one called butyrate especially, produced by all of these microbes or organisms, and actually suppress tumor growth, and a high fiber diet. So in the research, they've considered that more than 20 grams of fiber a day. High fiber diets might increase the effectiveness of immunotherapy for certain cancers. So the bottom line, again, is that a whole food plant-based diet, high in fiber, that can increase the number of beneficial microorganisms in the GI tract, might help with cancer, but certainly contribute to health in other ways too. Next slide, Lauren. And then to kind of bring it all back around, okay, what should I eat? What would it look like? I love these plate examples, again, from the American Institute for Cancer Research, showing old American plate on the left, where got like half the plate is your red meat, and then the rest of the plate is starchy vegetables, which these vegetables like potatoes and peas still provide some good nutrients, but they've also got some added butter on them. So like, how could we shift this to make it a little bit more in line with what we're looking for, which is the second plate, where we've replaced the peas with some non-starchy vegetables, the green beans, swapped out the potatoes with butter with some brown rice, and then we shrunk the portion of steak to about a quarter of the plate. So you can kind of see half the plate non-starchy vegetable, quarter of it is your starch or your rice, quarter of it is your meat, and then this last plate is really more of what we're looking for, where there's lots of color, again, that represents all of these phytonutrients of the plants that have all these cool functions to protect our body. So even like the chicken is covered with some spices, there's a bunch of different vegetables, and then the grain, I think, is supposed to be a quinoa seed, actually. So if you go to the next slide, I think that's actually, last one for me. And then we also talk about, like, if you wanted to try to include plant-based meals, there's definitely ways to make sure that you're getting enough protein out of your diet. And this is just a cute infographic of all of the different potential plant proteins. And I don't even think tofu is on here, but there's 16 different ways to get protein on here. So, that is it from me. And I think we're actually passing the baton to Rachel Milstein, who is our behavior change specialist. And this is like the secret sauce. The education's important, and then the behavior change is the magic. So go ahead, Rachel.
Great. Well, thank you so much, Carol. Always enlightening to hear from our dietary expert. So we've built in another little stretch break or movement break, in an effort to not only talk the talk, but to kind of literally walk the walk. So if you feel like moving your body, if you feel like standing, if you feel like stretching or shaking or any of the things that kind of feel good at this moment, please feel free to do that. And of course, throughout this talk at any point. So as Carol mentioned, I'm going to talk more about how we make these behavior changes. So we've got lots of fantastic information, and it can be really hard to do the things that we want to do. Let's talk about that. Okay, next slide. Yes. All right, so bridging the gap. So motivation is a fluctuating state, right? So we may kind of want to sleep more, for instance, or eat more plants, and all of those things can be, our knowledge can be there, but how do we bridge what we call this intention behavior gap? And that's what this sort of daring clip art figure is doing here, right? Bridging the intention to behavior gap. And as a preview of things to come, there's really no one way to do that. There's no kind of easy way to do that. However, we do know some things that can help close that gap. So, as I say, motivation is fluctuating, right? So today, after this webinar, you may say, this is fantastic. I'm going to eliminate, sugar sweetened beverages from my life. And then tomorrow, when you go to the grocery store and you walk through the gauntlet of sugar sweetened beverages, motivation might look different, right? Like we want to be very realistic about the factors that lead to change. And we'll talk about that. The other thing here that's important is that ambivalence is an important part of change. So ambivalence meaning wanting two things at the same time. So I want to, just in this example, I want to stop drinking sugar sweetened beverages. And on the other hand, I really enjoy them, right? They fill an important role in my afternoon and my energy slumps, and I look forward to it and all those things. So that's called ambivalence, and we welcome it, right? It's not a flaw, it's just part of the model of change. And the most important thing I want to share today is that, in lifestyle medicine and, in behavior change broadly, everyone has a potential for change. That's an underlying principle. So if you think you can't teach an old dog new tricks, I trained my 9-year-old rescue dog to become a therapy dog. So we all have potential to change. Okay, let's go to the next slide. In seeing this on my screen here, I see that this is a little small, so I'm going to walk us through this. So what influences behaviors? I'm going to invite us to take a very broad view here. We're going to look at behavior change through the lens of what we call the ecological model. And ecological models take a broad view of health behavior causation. We include the social and physical and even policy environment as contributors to our behavior. So when you think about making a health behavior change, a lifestyle behavior change, most of us think about this inner circle, which is the individual level. So if you can see it, it's great. If you can't, the individual level includes factors like demographics, or gender, our education, our socioeconomic status, our injury history. Again, in this case, I think caregiving could fit into this circle as well. We also think about our physical capacity, right? Our cognitive factors, our emotional factors, things like enjoyment of a behavior, expected benefits, intention, perceived benefits, our own emotional well-being, and self-efficacy, which is really important for behavior change. That's the belief in our ability to be able to do something. And then we move out to the next kind of concentric circle here, to the social level, or the interpersonal level. And this is where things like social support from our immediate, perhaps our immediate circle, whoever, if we live with anyone, what's their support looking like? Are we caregiving in this case? Do we have support from friends or peers? And what are the group norms around a particular behavior? If we were thinking about smoking, the group norms looked really different for many people 50 years ago than they do now. There's been really a tremendous change there, and that's all because of these different levels of change. But the next level of influence there is the social. Let's move out one more level, and this is our organizational level. So these are things like, what kinds of organizations are we spending our time in? What are the kind of policies there? What does our built environment look like? Are there stairs that we can take, for instance, if we're trying to increase our exercise, or is it mostly elevator based, that sort of thing? What does the organization prioritize in terms of health, or the opposite? If we move out one level, we get to the community level. So these are things where we think about, again, community resources, community support, but also what is our community, again, kind of built like? If we're talking about physical activity or nutrition, are there local places we could access healthy foods at a reasonable price? Or are there places we could walk or bike, or is it a car-dependent environment? Again, these apply to all the different lifestyle health behaviors, but just in terms of some specific examples. And then even farther out, the last sort of ring on this circle is public policy. So almost all of our behaviors are circumscribed in some way by the, kind of society and policies that we live within, right? So policy can affect lots of things. Again, if we're talking about cigarettes, taxation, for instance, on cigarettes, legal age to consume or purchase substances, or policy again for transportation. Can we take a bus or a train, or do we have to drive somewhere? Those kinds of things. So all of this is to say, right, there's lots of things that influence behavior, and we want to be very aware of what those are and what our barriers are at each level and what our resources are at each level. Because it's not just a willpower issue. It never is. There's lots and lots of other factors. Okay, let's go to the next slide, please. So following up from that, what makes it hard to engage in healthy behaviors? So I'm gonna, you can see these common ones here. You can also probably add a whole other slide of your own, right? Everyone has their own. But just some typical ones, right? Time demands. We're all here for an hour on this webinar, which is really a fantastic opportunity. And if we had been in person and you weren't already in Boston, would you have been able to take an extra, hour out of your day to get here, especially if you're caregiving or if you're undergoing treatments? There's a lot of barriers that time alone kind of puts out in front of us. Again, extra challenges for caregivers. We know that making healthy lifestyle behavior changes can be challenging for anyone. And when we are spending much, if not all of our time caregiving, there's another extra challenge there too. Challenge built out of love and respect and certainly gratitude. And again, we want to recognize that as a challenge. Again, our environment, our social support. Again, are the people in our life saying like, oh, just go ahead and have the cookie, or, if you're working on something like that, right? Or are they saying, hey, I know you're going through a hard time. I'm bringing you this, new American plate, for instance, this healthy eating plate. That's a different story when it comes to our social support and our food. Our thoughts can be barriers. Our feelings can be barriers, right? It can be really hard to get going when we're not feeling our best. Discomfort, disinterest, right? Motivation, again, fluctuates. Fatigue, let's just name it. Fatigue is a huge barrier to engaging in healthy behaviors. And on and on. So on that happy note, let's go to the next slide. How do we think about changing? So happily, we've had about kind of 70 or 80 years of really good research in behavioral psychology, behavior change. And there's lots of different theories of change. And there's been more recently in the past about 10 years, really great distillations of all of these theories into some knowledge that we can share in terms of common factors. So on the left side, expanding opportunities. So finding ways to do new behaviors, right? So expanding our opportunities to do something new. Extending the duration of existing opportunities. If you're, for instance, wanting to exercise and you're already out, walk to the next lamp pole or walk from your mailbox to the edge of the sidewalk, right? It doesn't have to be big, but finding ways to extend. Enhancing existing opportunities. So maybe if it's exercise, maybe you increase your pace or your intensity for even a short amount of time. Maybe you find more options to enhance what you're already doing. Maybe if you're at the grocery store, buy a different type of grain, whole grain. Intention formation on the right. This is the idea of creating not even just a goal, but an intention, having an interest in change and thinking about what that might look like for you. Most people have heard about or done something like a SMART goal before. We'll talk about that in more detail in a moment. But this is the idea of creating a very specific goal for yourself that has some components that make it more likely that you'll be able to meet that goal. Self-monitoring of behavior, which just means keeping track. So for instance, if you wear a Fitbit, that's self-monitoring. If you're, journaling, if you're keeping track of your sleep, for instance, you write down how many times you woke up each night, that's self-monitoring. Self-monitoring is one of the most predictive actions we can take of making change. So if you're not self-monitoring and you're interested in it, give it a try. It doesn't have to be, super complex or complete. Just any kind of keeping track really helps us get then the feedback on our performance. Hey, when I changed this happened. When I changed that, this did not happen. And that can give us this iterative cycle of improvement. And then reviewing our goals. We don't just want to kind of set it and forget it. Like it's, again, an ongoing dynamic process. So let's go to the next slide, please. So this is just one theory of change. There are many, as I say, but I like this one because I find it to be fairly understandable and concrete. So if you can't see this, you can maybe zoom your slides, or if you review this on YouTube, feel free to zoom in. I'm going to go around and then I'm going to give Alice a chance because I don't want to talk too much here and go into her time. But just to let you know, right, if we start at the kind of top left, the pre-contemplation is the light yellow. This means we don't even know that there's a problem, right? If we're talking about smoking, like we're happily smoking. We have no interest or kind of issue with smoking, no interest in changing. That's pre-contemplation. If you move to the right now, contemplation is the idea that we are aware that there's an issue or a problem that we're hoping to change. So someone says, hey, did you know smoking's bad for your health? And of course, this is kind of facetious because, yeah, we know. But at the time, maybe not everyone did. So, oh, there's an awareness. Oh, yeah, this could be a problem, but we're not ready to make a change. Move down to the blue. Preparation is when we start taking steps to get to a point of change. So maybe I'm ready to set a quit date, or maybe I'm ready to kind of, I don't know, dig out my weights, dust them off, something like that. It's exercise. Action is in the green, right? That's the very active state of making change. And then maintenance, right? So that's the kind of the goal that we're working towards. And if we kind of we can move out of the stage of change if we permanently quit, for instance, but for most health behaviors, it's fluctuating, it goes back and forth, back and forth, back and forth. So I just invite you to think about a change that you're interested in making and figure out where in this cycle that you may be and what it might take to move to the next stage, again, if you're able. All right, let's move on to the final slide. I think I'm going to actually move past this because we've talked about ways to make changes in each of these domains, but just as a reminder that there's all these 6 health behaviors to think about. Finally, a SMART goal, as promised. Think about making one change for yourself this week. Specific, measurable, actionable, realistic, and time-bound. So think about for a week what you want to do. Think about something that you actually can do, that is measurable. You can keep track of it in some way. And that you're ready to do.
And thank you to everyone who has joined today and everyone who watches this as a recording. I do want to address one of the questions, and then Amy, I'll turn it over to you because I just happened to see it in the chat in regards to sort of maybe the location of the consultations in the lifestyle medicine program for the Cancer Center. And in fact, it is virtual. So as long as you live or can be in the state of Massachusetts for the consultation, then if you have a Zoom or a way to look at a screen, we've also done telehealth if we have to, then we can go ahead and see you. So that is how that works. All right, Amy, I'll turn it over to you.
Thank you, Lauren. Thank you, everyone, for today. You had mentioned there were some resources that you recommend. Would you mind reminding what that resource is again, and any additional resources you have for everyone?
Yes, we actually have that in a slide, which I wonder, it's long and lengthy, we can't possibly read them all, but I wondered if that could somehow, well, certainly it will be in recording, which folks can view and sort of pause, but I don't know if there's any other way, Amy, that folks could get their hands on this list of resources. So some of them are the citations that were used throughout the talk, and some are links to different organizations like the American College of Lifestyle Medicine and the AICR and things like that we talked about.
Yeah, thank you. I mean, what we can do is, if you don't mind, you can send me either a screenshot or that slide. And then anyone who's interested in a copy of this slide, feel free to email the Blum Center. I'm going to put that also in the chat for everyone. We are at pflc@partners.org, and that just simply stands for Patient Family Learning Center. Feel free to email us, and we'd be happy to share that list of resources with you all.
Sounds good.
All right. Alice, anyone who may be able to join, like, I don't know if you have any thoughts on, the importance of setting small goals. Do you have any words of encouragement, suggestions, or if you feel like there are any setbacks, not quite meeting those goals?
Are you were asking me about goals? Yeah, I think you have to be very, very realistic about what it is that you're trying to achieve. I know that if somebody says to me, I'm going to take all the candy bars away from you, I would probably kill them. I mean, it just, it really depends what you're ready for. And that's where it really helps to have somebody in the wellness center to be able to talk to set reasonable goals. And I will say that it's so different from a caregiver perspective than it was from being a patient perspective. I was the best patient on the planet. And I find that my goals as a caregiver are much tougher, actually, to try to grapple with. But again, don't set anything too crazy, really. Be kind to yourself. That's the most important thing. I probably would say that the biggest thing I have learned is to say to myself, don't be so hard on yourself. Really, because there's a lot on your shoulders, so don't dump on yourself. So that's my little word of advice.
Thank you, Alice. This is perfect. Lauren, did you have anything else you'd like to add?
No, I just completely agree with what Alice said. And I think that the more we can, you know, show a little self-love, if I'll be that corny, this idea of patience as well, I think is really critical as you move through behavioral change. Even start to consider what one thing, like Rachel prompted, you might do for yourself. Remember, anything you do in the lifestyle medicine realm is really for yourself, for the betterment of your health. And then if your health is better, any little degree, it really does translate into how you are with others in the world, how you show up, right? So any little thing counts. Be patient, be kind to yourself, and I just love that we ended on that note. So thank you so much, Alice.
Thank you. This was perfect. As I had mentioned, today's session is being recorded. If you're interested in viewing the recording, feel free to visit the Blum Center website. It'll be made available probably, I would say, in a couple of weeks. And we are at massgeneral.org/Blum-Center. I also included that in the chat for everyone. All right, everyone. So I think we are at time. Special thanks to Alice for joining us today and the Lifestyle Medicine team. Greatly appreciate your time. And for everyone who joined us, thank you so much. Hopefully you found today's session helpful. And I think that concludes today's session. Thank you, everyone. Take care.